The patients in America believe we need to fix the broken system. We have jackpot lotteries going on right now. And what we do need to focus on is the patient.
We must prevent excessive awards that drive up costs, encourage frivolous lawsuits, and promote drawn-out legal proceedings, and that is why we need a reasonable federal...
Medical liability reform is so necessary, and our legislators and our judges can make a difference by reforming it.
From the halls of Congress to county courthouse steps across the country, the American Medical Association is championing common sense solutions to America's medical liability crisis. The AMA is fighting for America's physicians and their patients because the current liability crisis is threatening the future of our medical profession.
These were our exam rooms. Everything's been cleaned out. This used to be my office.
During just the past year alone, medical liability premiums have skyrocketed more than 100% on average for internists, general surgeons, and OBGYNs.
Doctors, hospitals, and nurses are being sued in large numbers, in large part because of the possibility of a settlement or trial judgment of a large amount of money.
As a result, women in some parts of the country can't find an OBGYN to deliver their babies. Trauma patients are losing the golden hour because their local trauma centers were forced to close.
If you are in a motor vehicle accident and you need a trauma center, we have seen trauma centers close because of these escalating, out-of-sight, skyrocketing premiums which no longer can be tolerated. If you are one of those individuals that need that care, the access is not there, you are going to be hurt.
In state liability premiums are highest, physicians are moving elsewhere to practice or retiring early. In short, patients' lives are at stake and a cure is needed.
You cannot get quality medical care if you cannot find a physician.
This needs to be the AMA's highest priority. Without this, you can't expand access. Without this, you lose from the profession and our promotion of science goes down. This is the biggest issue we have.
The AMA has been working to organize a national coalition of leading state and specialty medical societies. The mission? Get Congress to pass the law that has protected California's patients for more than 25 years. Get Congress to pass MICRA.
We have a system in California that's worked for over 25 years. It brought stability to the professional liability market, and we need to make sure that patients have access to doctors, we have quality, and that continue to go up because of the broken liability system. We have to look at everybody in America, and that's the grave responsibility of Congress and the grave responsibility of legislatures. And those legislatures that passed tort reform, medical liability reform in 1975 are the states with stability, Louisiana, Indiana, New Mexico, and California.
This year, the AMA has been on the ground rallying with physicians and patients in Florida.
Hundreds of nurses rallied.
The legal system is broken and we're going to get it fixed.
The American Medical Association agrees.
In Georgia,
American Medical Association Dr. Donald Palmisano rallied for change.
We see intimidation at work here, and we see fear. We see doctors practicing defensive medicine.
The AMA says legislative reform comes down to controlling a medical malpractice industry now out of control.
In Illinois,
this is a map. It shows 12 states in crisis. You heard about it a moment ago. There are only 6 states that are not in crisis or showing signs of problems. The rest of the states, including Illinois, show problems.
Nevada.
And I know that the American Medical Association is hoping to do something to kind of stop this crisis.
The main goal is to have access to care for the citizens of Nevada. And right now you're losing your doctors, the insurance companies are leaving, something's very wrong with the system.
And Ohio.
A big crowd gathered State House at this hour this morning. Doctors who say they can't continue to practice medicine if their malpractice insurance continues to climb.
Joining us right now from the American Medical Association, Dr. Abramowitz.
We feel this problem is not just Ohio, but nationwide, but we feel it's so very, very important to be here because it affects patient access when the patients need the care.
We certainly need reasoned debate. The health of the nation depends on it. We need reasoned debate, and we need to look at a treatment that works. And let's go to California. It works. Let's give more money to patients. Let's fix the system so doctors will be there. As Secretary Thompson said today, a threat to the doctors is a threat to the patients.